Hi, my name is Kaylee, and I will be giving my informational speech on the specialized tests in phlebotomy. I will explain the various special tests along with the unique procedures required for these tests for accurate specimen collections. So, have you ever wondered when you're getting your blood drawn that some blood tests are more complicated than others? The answer to this is that specific test requirements of specialized tests go beyond the standard blood draws and into a realm of specialized phlebotomy. First, before diving into the specialized tests, I will give you a brief introduction to some of the commonly used tools in phlebotomy. In phlebotomy, for venipuncture, we have two types of needles. We have our straight needles and we have our butterfly needles. Our straight needles are most commonly used in adults with healthy veins, and the most common size we use is a 21 gauge. And then in children and adults or elderly patients with fragile veins, we use our butterfly needles. Our butterfly needles, we commonly use a 22 to 23 gauge. And gauge works, the higher you go up, the smaller it is. So the 23 gauges are on the smaller end, and our 21 gauges are on the bigger end. And then we also use a hub. This is connected to the end of the needle to create a vacuum for our tubes. And then the tubes will then collect our blood samples. Also in phlebotomy, there is a specific order that the tubes must be collected in to prevent errors in transfers between the different additives in the tubes. This is called our order of draw. For our order of draw, we begin with our blood cultures. Then we have our light blue tops, our red tops, our gold or tiger tops, and then we have light green, dark green, lavender, pink, and our gray tops are the most commonly used tubes in our order of draw. The first special tests in phlebotomy are our time tests. These tests are procedures done over a period of time and very specific intervals, and these measure how our body metabolizes a substance over time. An example of this time test is our glucose tolerance test. This test requires a basal state, so no strenuous exercise and no food or by mouth for 8 to 12 hours before the test except water. You will have your blood drawn before to have an interval before you drink the glucose solution. Then once you drink the glucose solution, you will have your blood measured over a 1, 2, or 3 hour period. This is to diagnose any prediabetes, type 2 diabetes, and gestational diabetes. This test is also used to help monitor glucose levels in individuals with diabetes. Then in our specialized tests, we have a specific collection method. An example of this one is our blood culture bottles. These identify the presence of any bacteria in the bloodstream. These are very critical for diagnosing infections such as sepsis. Any contamination can lead to a false positive and incorrect treatment. These tests require a special 2-step cleansing technique to prevent any bacteria from entering the bottles from your skin. You will clean the skin before you're entering with the needle and the tops of the blood culture bottles with 70% isopropyl alcohol, which is the standard for all blood draws, and it will follow with 2% chlorhexidine. For our non-venous samples, we have our arterial blood gas. So in other tests in phlebotomy, we enter through the vein or our antecubital fossa, which is your crease of your elbow. But for other non-venous samples, we do something through capillary punctures. These are either through the lateral sides of your third and fourth fingers, or for infants and young children, it'll be the calcaneus and the lateral sides of the calcaneus. It is the first sample of blood that is collected in capillary punctures, as this blood is arterial blood. And this test provides a little bit of a snapshot of the patient's respiratory and metabolic status, including the oxygen and carbon dioxide levels in the blood. For These three categories of specialized tests discussed: our time tests, our specific collection methods, and our non-venous samples. They each play a very crucial role in a phlebotomist's job. The seemingly very simple act of blood draw is actually a very highly complex procedure with many tests you have to memorize. So the next time you see or encounter a phlebotomist, you'll have a new appreciation for the very diverse and specialized skills they have to ensure for your health information is accurate. Thank you for listening to my speech.